Opioid use continues to take lives across the country and here at home in West Michigan. Tragedy that could be prevented.
A study published recently says states with medical marijuana programs are seeing less overdose deaths. 24-hour News 8's Zach Horner is in studio control with more on why medical marijuana could be saving lives. Zach?
Well, Brian and Marley, it's been studied for decades, and marijuana has proven medicinal properties. Some are choosing what one study says is a much safer option instead of heading to the pharmacy.
Since the 1990s, we've had a threefold increase in opiate overdose fatalities.
Published last month in the peer-reviewed Journal of Health Economics, states with medical marijuana programs see less use of prescription opioids and less fatal overdoses.
But the common thread is that most people, even that overdose on heroin, started off with prescription opiates for pain.
Dr. David Crocker, who runs Michigan Holistic Health, believes marijuana to be a healthier option to prescription opioids.
And the beauty of marijuana, number one, is that it works. And number two, people don't overdose or kill themselves with it.
Like much of the United States, West Michigan is in the middle of its own opioid epidemic. I reached out to the Kent County Health Department and they tell me there were 105 opioid overdose deaths in 2017, nearly one every 3 days.
People get very out of balance taking narcotics long term often. And the nice thing about cannabis is the way that it actually works in the body is it's a balancing agent.
He believes there are better and safer options for medical marijuana patients.
It helps the pain directly. But a lot of our patients will come back a couple of months later and say, well, yeah, my pain's better, and I'm sleeping better, and I'm getting along with my spouse better, and I just generally feel better, and I'm happier.
Coalition to Regulate Marijuana Like Alcohol turned in their signatures last month to get marijuana legalization on the ballot this upcoming November. It's to be seen whether the initiative gets a public vote, but Dr. Crocker thinks better access to marijuana at the recreational level will have a positive impact.
Having access to it in a more anonymous, less restrictive way, I think will make it more available and probably continue to reduce the opiate overdoses.
The Diagnostic and Statistical Manual of Mental Disorders, or DSM-5, which is currently used for diagnostics and mental health treatment, lists a potential diagnosis as cannabis use disorder, indicating it is possible to develop a problem with marijuana. Now, currently in Michigan, marijuana can only be used with a doctor's recommendation and state approval. In studio control tonight, I'm Zach Horner, 24-hour News 8.